And apart from the efficacy of these vaccines as well as the side effects, recently we've been hearing that there are fatalities from the COVID-19 vaccines, particularly in Norway. And
Yes.
according to a well-known virologist, Dr. Yong he actually said that the deaths of people who die after being injected with COVID-19 vaccines are not always related to vaccines. Therefore, there is a need to determine whether there is any connection between the death and the vaccine. Citing reports of the 23 fatalities among elderly people in Norway after they were inoculated against COVID-19, the virologist from the Faculty of Medicine at Chulalongkorn University said that it should not be assumed that all the fatalities were related to the COVID-19 vaccine without investigation. From his 30 years of experience studying vaccines, Dr. Yong said that even when a person who was vaccinated dies from falling down a manhole, the case must be investigated to find out if side effects from the vaccine led to the fatal fall. Citing another case of a volunteer who was shot dead 2 days after his vaccination, he said that an investigation was carried out to find out whether it was possible that the vaccine might cause the volunteer to become aggressive and hence was shot dead. Regarding the 23 fatalities in Norway, he said that most of them were over 80 years old and some of them had comorbidities, which could have led to their deaths. Noting that more than 14 million doses of COVID-19 vaccines, most of them manufactured by Pfizer, have been injected into millions of people. He predicted that there will be more fatalities among those vaccinated. Since all the vaccines are new, he stressed the need to monitor the conditions of those vaccinated, especially for any negative side effects. So you can see that although there have been cases of fatalities from the COVID-19 vaccines, he actually said that there must be an investigation to see whether it's really from the vaccine or is there something else behind it as well.
Yes, and out of 23 fatalities, 13 of them are over 80 years old. But Norway inoculated, like, if I remember correctly, like 20,000 people. So there is a chance there that you become very sick, and they say it's from side effect. But like Dr. Yong said, they have to investigate further.